Hi, my name is Ashlyn Goodenough, and today I'll be doing a slideshow on specific phobia disorder. It's the one I was assigned for the midterm. So, a definition or a description would be a specific situation or object that creates immediate anxiety for the patient and they tend to avoid it. And with the serious cases, even a mention or depiction of that situation or object will send them into high anxiety. And usually the phobias are unreasonable. Some symptoms that are associated with specific phobia disorder they tend to include anxiety, of course, a feeling of immediate danger, the need to escape, heart palpitations, sweating or trembling, shortness of breath or smothering feeling of choking, shortness of breath, chest pain, nausea, feeling faint, dizzy, or lightheaded, a sense of things being unreal, so depersonalization, going crazy or losing control, a fear of dying, tingling sensations, and chills / heat flushes, so like heat flashes and stuff. I did the case study that was in our main textbook. I was looking at it and just trying to that's where I got some of my symptoms from. But it's on Ether Dugani. She developed a tremor that was associated with, as a characteristic of early Parkinson's disease. And what triggered it is her mom dying 10 days earlier. And she had to fly to set up arrangements for her mother's funeral. She couldn't fly, so she started seeking help for it. She's flown before, but she had a traumatic experience with the plane trying to land. It couldn't land for 3 hours, and it was some major turbulence going on. So the thought of going on another airplane or going to an airport gave her really high anxiety, and she hasn't traveled for years. And she realized that it was unreasonable and silly for her to have this fear of an airplane. And it embarrassed her. So she wanted some help. I did an analysis. Usually specific phobia is not usually associated with any general medical condition or substance-induced disorders. But others, clinicians should ask about possible comorbid diagnoses. Pending that, and with a GAF, so GAF is a Global Assessment of Functioning score of 75, her diagnosis would be given. Ether had only one phobia, a situational one, and hers is flying an airplane, so it'd be F40, 20, 48, 30, 29. The average is 3 for each person, which would be listed on a separate line of its own, with its own number. Here's some coding and the criteria. So animal types, snakes, spiders, dogs, such like that. There's natural environment, which is thunderstorms, heights, anything of that nature. There's a phobia for blood. There's one for injections and transfusions. There's other medical care. There's one being having fear of getting an injury. There's situational, which is what Ether had, which is traveling by air, being closed in, so like claustrophobic. I'm kind of claustrophobic. And there's other types, so situations where the person could vomit or choke is one, or for children, loud noises and people wearing costumes, i.e. clowns. I am definitely afraid of clowns, so I would have claustrophobia and other types. I'd be listed as one of those. Prognosis onset is usually in childhood or adolescence, being after a traumatic event, which is usually dealt with animal phobias. Tend to have a comorbid disorder such as depression and substance misuse. The duration is 6 or more months. Distress or debility, which will infect work, education, social and personal life. Differentiate diagnosis, so substance use and physical disorders, agoraphobia, social anxiety disorder, separation anxiety disorder, mood and psychotic disorders, anorexia nervosa, OCD, and PTSD. Prevalence in children is lifetime prevalence is 13 to 18 years, so there's 15.1% of 13 to 18 year olds. The prevalence of severe disorders are 0.6%. The demographics are 16.8% are females, 13.5% are males, 16.7% are ages 13 to 17, 14.3% is 15 to 16, and 14% is 17 to 18 year olds. For adults, 12 months prevalence is 8.7% of the U.S. adult population. The severe cases would be 21.9% of those cases, i.e. being 1.9% of the U.S. populations that are adults are classified as severe. The demographics are those: there's 13.3% of age 18 to 29, 13.9% is 30 to 44, 14.1% is 45 to 59, and 7.5% is age 60 and above. There are some treatments. The vast majority of people with an anxiety disorder can be helped with professional help. Success of treatment varies on the phobia and how they would respond to the treatment. They can respond after a few months, or it could take over a year for them to respond to the treatment and it be successful. Treatment may be complicated if people have more than one anxiety disorder or suffer from depression or substance abuse. This is why the treatment has to be tailored to the individual. It has to be just for them. Particularly cognitive behavioral therapy, CBT, has proved to be the most effective, which is the standard approach. They will try that first. In general, CBT can work for those with specific phobia. Weekly treatment with homework assignments usually succeeds in 12 to 16 sessions. Secondly comes exposure or confronting the fear situation. So let's say a person is afraid of dogs. The therapist will take them to, let's say, a dog park or someone that they know the dog, and slowly getting closer to the dog to where they trust the dog and that they get over the fear of the dog. Another one would be if somebody's afraid of thunderstorms, the therapist could take them to a house and during the thunderstorm and have them stand by the window and learning to take acceptable risks that are relatively safe to be around the thunderstorm so they get used to it and hopefully end the fear of a thunderstorm. Some medications can help reduce the anxiety and panic symptoms you experience from thinking about or being exposed to the object or situation you fear. So there's the medications, which there could be beta blockers. These drugs block the stimulating effects of adrenaline, such as increased heart rate, elevated blood pressure, pounding heart, and shaking voice and limbs that are caused by anxiety. The other one is sedatives. These medications are called benzodiazepines. Help you relax by reducing the amount of anxiety you feel. Sedatives are to be used with caution because they're very highly addictive, and you should avoid them if you have a history of alcohol or drug dependency. I put a personal affiliation. Personally, I was glad I got assigned specific phobia because I have a specific phobia that most people laugh at because they think it's stupid and ridiculous. How can you be afraid of clowns, right? Well, when I was like 12 or 13, I was playing flashlight tag with my family, my cousins and friends, and my uncle decided to be funny to dress up as a clown and hide. And when I got near him, he jumped out and scared me half to death. Ever since then, I've been afraid of clowns, like deathly afraid of clowns. Every time I see one, I will avoid him. I will go the long way around if I have to, just to get around that clown. If I hear there's gonna be clowns at like a haunted forest or a haunted house, and I love Halloween, I love that kind of stuff, I will not go. I cannot deal with clowns. My family likes to try and provoke my fear, and it's not the best. They're kind of mean. But these are the references I used. I used Mayo Clinic, our textbook, the DSM-5 Made Easy, ADAA, which is the Anxiety and Depression Association of America. I used MIMH for the demographics on the adults and for the demographics on children, and I also used our interview guide for evaluating DSM-5 by Zimmerman. And that is my presentation. I hope you guys enjoyed it. Leave any comments or questions you may have about a specific phobia, and maybe I can help diagnose you with a specific phobia.